Thank you very much. So we're going to make this very brief so we can catch up in time. Here are my disclosures. So just a show of hands, who here has operated on a COVID positive patient, either laparoscopic or open? Great. When you first operated on that patient, did you know what to do? Did you know what energy you're supposed to use? Did you know if you should open? So actually, Sages, we did a webinar back in, I think, June of 2020 during the height of the COVID pandemic. On that webinar, we had 3,000 surgeons around the world chiming in, trying to figure out how to take care of these patients. So when Fuse started, we actually didn't have this topic of aerosolization and smoke risk and everything. I have my very good friend here, Dr. Luis Chioco Benitez from Peru. When he called me, he asked me, is it okay if we put our gas into a chlorinated water and bubble it through that way to kill the virus? We had no idea. So since then, there has been so much research on COVID and aerosolization, and hopefully I can bring this to light today. So basically we know, what we really should concentrate on is the surgical smoke. We all kind of dwelled on viruses coming out with laparoscopic surgery, but the surgical smoke is what's gonna kill us day in and day out if we don't take care of it. So surgical smoke has over 150 chemicals. It's equivalent to smoking 27 to 30 cigarettes a day. So for those who are non-smokers, if you operate, you're a smoker unless you use these agents to help you. So we're all exposed to it. It can cause some bad symptoms, especially if you're doing liver sections open and you have so much smoke coming out from your electrosurgical pencils. It can cause these problems here. And also, it can cause problems for our patients. If you're doing head and neck surgery or something simple and the patient is not intubated, some of the surgical smoke can affect your patients. So the best way to mitigate surgical smoke is to have a multi-faceted system. So a capture device, you need a vacuum source, and you need inline filtration. So I'll talk about these quickly here. So we know with different surgical energy systems, it produces different types of plume and different sizes of plume. So this is very important. So using ultrasonic technology where really not energy, but vibrational energy causing these particles to form. So these form larger particles. When we use electrosurgical pencils, these form very, very small particles. So laparoscopic cholecystectomy on a COVID patient, on an open patient, you're gonna have these very small particles form, and that's why mitigating your gas release from your laparoscopic ports are very important. So filtration in general, so we probably all know this. Filtration may be an effective means of protecting the OR and yourself from the release of smoke and potential sources of infection during surgery. So N95s, we know we wear them every day. So 95% of particles that are greater than 0.3 microns can be filtered. So that's a very important number to know, right? HEPA filters, 99.97% of 0.3 microns or larger. What you really need to be using in the OR are something called ULPA filters, which is ultra-low particulate air filters, which can filter out 99.9999% of particles 0.12 microns or larger. So this is a very good chart to know, and if you don't have this chart, I'd be happy to send it to you, but this is called the hierarchy of control. This is how you need to view a patient when they come in with COVID, right? If you've never operated on a patient, this is the hierarchy of control. So you want to eliminate the risk. So basically, most ORs, if not all operating rooms, are positive pressured ORs. Most endoscopy suites are negative pressured ORs. So positive pressure means air is being blown in, and there are vents that suction the air out. And why do you want that, right? Because somebody walks into your OR, you don't want a negative pressure room. All that air outside the OR gets sucked in. You actually want air to be pushed out. Substitution, so basically removing whatever particles are in the air by blowing them out. Engineering controls, only necessary people are in the OR. On a COVID positive patient, the doors are actually sealed, so only things are passed in through usually doors and everything. One door is open, pass in, the other door is closed, and then you can get your things that you need. Administrative controls. You have to educate the people that are working in the OR. This is what we need to do. We're going to be very careful during intubation, extubation. We're going to be very careful when we release gas. And of course, the least effective way is wearing the proper protective equipment like N95 mask. So we all know about SARS. The key thing I want to point out here, it's a very, very small virus. It's a 0.06 to 0.14 micron virus. So an N95 mask shouldn't be able to block this virus, but it does, and I'll tell you how it does in a little while here. So other viruses that we know get passed into gas, we know that bacteria can get passed, we know hepatitis can get passed into surgical smoke. We know condylomas can get passed, right? If you do condyloma surgery, you gotta wear that space suit. But what we didn't know is how little of a virus you need to get infected. So for norovirus, just 18 particles can get you affected. For influenza, 10 viral particles. So we think COVID is like influenza. It just takes a little inoculum to get you infected. So when the Omicron variant came out, so many people were getting infected, and I think it's because it just took very, very low doses to get infected. So what do you need to do? So smoke can be, if not evacuated, can be detected in the OR for about 20 minutes. I talked about HPV and bacteria can be in smoke. The risks when you wear N95s in the OR are less. So surgical smoke in consideration open surgery, we should always use the Alpo filter. You should, if you have a suction device, like your Yankauer suction, it should be 2 inches away, and that can catch 95 to 90% of smoke, but that suction device has to be hooked up to an Alpo filter. It can't be hooked up to a canister. That does your OR staff, it gives them no protection from viruses. So for laparoscopic surgery, I'm going to run through this very quickly. So basically, very simple principles. Make your ports, incisions as small as possible. Always use an Alpo filter on your insufflation device. Keep the pneumoperitoneum pressure as low as possible. When you suction CO2 with your suction device, try not to do that because that will be suctioned into your canister unless there's an Alpo filter on it. Set your electrosurgical units to the lowest setting, and during desufflation, that's the most important time. If your insufflator has a desufflation mode, use that. If not, you need to get that CO2 gas into an Alpo filter type suction device. When you operate it on a COVID positive patient or any other high-risk patient with a viral blow that could infect you, everybody in the OR should wear an N95 mask. Once again, desufflate before you open if you need to open. Specimens should removed once all the CO2 gas is removed. Suture closure devices can release gas, so be very careful with that. And if you have to go hand-assisted, just release the CO2 prior to that. So this is the SAGES EAES recommendation for surgical response to COVID. Basically what I've talked about today, and this slide set is available on the SAGES website. And lastly, a very good paper about things to do, and you have to have a plan, right? Structured, frequent communication when you're operating on a COVID positive patient. Assume the entire OR is going to be infected. Choose the right equipment, and also have like an assistant or somebody else help you take your mask off and everything. That kind of helps lower the risk of getting infected. So in conclusion, protect yourself and your OR staff from being infected. Adapt these surgical techniques. Once again, the multifaceted approach is the right way to go. Proper room filtration, appropriate personal protective gear, and smoke evacuation devices. Thank you very much.